In the year 2022, hundreds of Americans fell violently ill after consuming a seemingly harmless food ingredient called TerraFlower. When scientists traced the outbreak and contacted the FDA to review the safety data on this additive, they found an empty file. The agency had absolutely no record that TerraFlower was being used in human food. How does a chemical compound end up distributed nationwide in our food supply without the government even knowing it exists? The TerraFlower outbreak exposed an ongoing systemic reality. Thousands of hidden, unmonitored chemicals are sitting on grocery shelves right now, completely legally. Meanwhile, public health officials are tracking a severe, unexplained rise in early-onset gastrointestinal and colorectal cancers among younger adults. This animated graph charts biological aging against chronological age. It shows a sharp upward divergence, indicating accelerated aging for cohorts born after 1965. This trend line links rapid aging in adipose tissue directly to elevated early-onset colorectal cancer risks. Physiologists measure this wear and tear using a concept called allostatic load. When your body tries to maintain homeostasis against chronic metabolic and environmental stressors, the biological cost accumulates. To find out what is causing this physical stress, researchers study our exposome, the total accumulation of environmental exposures over a lifetime. But they hit a wall. Scientists cannot accurately track what is driving this allostatic load because food manufacturers are legally permitted to conceal the chemical additives we consume. The medical community is trying to solve a generational health crisis while legally blindfolded from examining the very ingredients causing it. In 1958, Congress passed strict food additive amendments. The baseline rule was simple. The government controlled what went into your food. If a manufacturer wanted to introduce a new chemical, government scientists had to rigorously test it. The FDA would then formally publish its safety approval in the Federal Register. But by the 1990s, food technology rapidly accelerated. An influx of new synthetic additives flooded the agency. Lacking the budget and staff to keep up, the FDA was buried under a massive backlog of complex safety petitions. To clear the bottleneck, the FDA proposed an interim fix in 1997, a system of voluntary notification. Instead of government testing, companies could hire their own private experts to declare their ingredients safe. This temporary measure lasted nearly 2 decades. In 2014, consumer advocacy groups sued the FDA, arguing the agency had unlawfully abandoned its duty to police the food supply. The resulting court decision forced the FDA to act. The agency issued a final rule in 2016 that permanently codified this voluntary self-policing framework into federal law. Through decades of bureaucratic delays, the U.S. government transformed from a strict regulatory gatekeeper into a passive bystander. This animated flowchart maps out the modern legal loophole, starting with the secret GRAS pathway. A corporation can synthesize a new chemical, pay a private panel of consultants to certify its safety, and immediately sell it to consumers. They are under no obligation to ever notify the FDA. Even when a company submits a safety notice, there is an escape hatch. Look at this secondary path into the FDA. If scientists flag the chemical for missing toxicity data, they send the company a warning. When that happens, the manufacturer can simply ask the FDA to cease its evaluation. The investigation is officially killed, and the company routes the chemical straight to the market anyway, relying on their original self-certification. The current system actively rewards corporate secrecy, legally permitting food manufacturers to bypass and dismiss federal safety warnings entirely. We are now seeing the physiological cost of these blind spots. This unregulated pipeline of hidden chemicals feeds directly into our digestive systems, steadily increasing the metabolic stress and allostatic load placed on our gastrointestinal tracts. Our internal homeostatic mechanisms are fighting a constant battle against an influx of synthetic additives. At the exact same time, the federal agency meant to protect us has made its own oversight completely optional. A legal framework designed in 1958 to protect public health has been inverted to protect corporate trade secrets. Today, the American consumer is the unwitting subject of a massive, self-policed chemical experiment.